I'm Iona and I'm going to talk you through our study on the effects of fatigue in chronic disease on mental health. Fatigue is defined as whole body exhaustion which is not proportional to recent activity. It's associated with many chronic diseases and poorer quality of life. Assessing fatigue can be challenging as it is subjective and varies between patients and disease populations. This small-scale feasibility study aimed to investigate the experiences of patients with chronic illness and fatigue, focusing particularly on mental health, in order to guide the development of measures of fatigue which are meaningful to patients themselves. We recruited 83 adults with chronic illness and fatigue using a crowdsourcing website. These participants then completed a survey about their experience of fatigue, fatigue-related symptoms, and fatigue management. Responses were analysed using a qualitative thematic approach consisting of 3 stages: data familiarisation, identifying key issues and concepts, and finally clustering and organising themes. We found that 3/4 of participants reported multiple chronic illnesses, of which 75% reported at least one mental health condition. Depression and anxiety were particularly common, affecting 47% and 39% of all participants respectively, as shown here in Figure 3. When asked to describe the most significant symptoms of fatigue, many participants reported symptoms related to mental health, shown in blue on Figure 4. Low mood was the most common symptom of fatigue, and broader depressive symptoms were described by 64% of participants, including those with no formal mental health condition, indicating that these symptoms are specific experiences of fatigue. Many participants reported that fatigue affected their ability to engage in physical activity and social interaction, shown in Figure 5 here. This may impair their ability to manage their mental health-related symptoms of fatigue. Overall, this study highlights the ubiquity of poor mental health in those with chronic illness and fatigue. Symptoms of depression are particularly common, as seen through both high incidence of formally diagnosed depression in those with chronic illnesses, and in the high prevalence of fatigue-related depressive symptoms in both those with and without mental health conditions. While this study is limited by small sample size and the constraints of the questionnaire format, this indicates that managing fatigue may be an important focus for improving mental health in those with chronic illness. The finding that experiences of fatigue change over time signposts a need for time-sensitive assessments. High-frequency digital tests may address this need, providing short, at-home tests which can capture temporal changes and place minimal burden on participants.